Hi everyone, it's Ryan Liberty, and in this video I'm going to answer the question, what is bipolar 2 disorder? Alright, let's get into what bipolar 2 disorder is. Before I do, I just have to say that this is not the diagnostic criteria for bipolar 2 disorder. If you're seeking a diagnosis, do not use the information in this video. You'd have to see a licensed professional, such as a therapist, for that anyway. Just don't use what I'm talking about here. This is just a description of what may be going on when we're talking about bipolar 2 disorder. In addition to that, if the label of bipolar 2 disorder, if for any way it doesn't sit well with you, it gives you pain, it doesn't help you to heal, if you don't like it, you don't have to use the label bipolar 2 disorder. It's just here to point you towards something that may be going on in your life or the life of someone that you loved. That out of the way, let's get into what bipolar 2 disorder is. First, normally you'd abbreviate bipolar in general as BP, but when it comes to bipolar 2 disorder, you must have hypomanic and major depressive episodes. I'm going to describe them in a minute here, but you must never have had a manic episode. And if you want a better description of a manic episode, look into my bipolar 1 disorder, because that is something that is used to diagnose bipolar 1. But I'll give you a quick little comparison in a second here, because you have to have hypomanic episodes to have bipolar 2. So a hypomanic episode is a persistently and abnormally irritable, expansive, or elevated mood with increased energy and goal-directed activity. And it's something that lasts for 4 consecutive days. And the primary difference between a hypomanic episode and a manic episode is that length of time. You have 4 consecutive days for a hypomanic episode and a week or more for a manic episode. There are other differences, so if you want more clarification, check out my bipolar 1 video, but that's the big major difference. So for a hypomanic episode, you have to have 3 of the following list that I'm going to give you present. If your mood is only irritable, it's not expansive or elevated, you have to have 4 present. So 3 at least of these present, and that is grandiosity or inflated self-esteem, diminished need for sleep, feeling rested after only a couple of hours, for example, pressure to keep talking or more talkative than usual, feeling that your thoughts are racing or having what's called like a flight of ideas. You're easily distracted, and that's something that can be reported by other people. Increased goal-directed activity or purposeless activity, such as fidgeting. And increased activities that have high potential for poor consequences, so things like sexual promiscuity, spending sprees, making poor investments, things like that. So 3 of those has to be present. 4 if your mood is only irritable. And when we're talking about a hypomanic episode, still, it can't be something that's significant enough to interfere with your everyday life, require hospitalization, or have psychotic features. None of that is going on. That would be more towards a manic episode. And also, it's when we're talking about a hypomanic episode, it is a change in your normal functioning that is different from when you're asymptomatic, and other people would be able to see that there's a change in you. So you have those hypomanic episodes. We also have major depressive episodes going on when we're talking about bipolar 2. So let's get into what those are. Major depressive episodes, sometimes they're abbreviated as MDE. You have to have a 2-week period where you're either in a depressed mood or you have a diminished interest in pleasure in most activities. And this happens most of the day, nearly every day. And it's something that either you can be describing or somebody else can see it in you. And you have to have most of these things going on when we're talking about a major depressive episode. So significant change in appetite or weight. In children, this could look like a failure to make their age-appropriate weight gain. Insomnia or hypersomnia almost every day. Excessive activity or slowed activity, so fidgeting, pulling at clothes, slowed speech, slowed reactions, and that's something that has to be observed by other people. Fatigue or loss of energy nearly every day. Excessive or inappropriate guilt over things, possibly a delusional guilt, and feelings of worthlessness nearly every day. Diminished ability to concentrate, having indecisiveness nearly every day, and that can be observed by yourself or by other people. And recurring thoughts about death, suicidal ideation without a specific plan, or suicide attempts. All of this has to cause significant disturbance to your everyday functioning, and it's not something that's due to a substance or a medical condition. Now, when we're talking about a major depressive episode, we have to distinguish it from a grief, and a significant loss could result in a major depressive episode, but it could also just be regular grieving. So let's just get into the difference between the two of those very quickly. So grieving has feelings of emptiness and loss. Depression has depressed mood or inability to experience pleasure. Grieving comes in waves. Depression's more persistent. Grieving has happy or positive moods sometimes. Depression is a more pervasive unhappiness. Grieving, there are thoughts and memories about what was lost. Depression is more about self-criticism and rumination over things. Grieving, your self-esteem remains intact, and if there is any derogatory feelings towards yourself, they're usually related to a failing that you had in relation to whatever it is that you lost. When it comes to depression, there's just feelings of self-loathing and worthlessness. When there's grieving, we're thinking about death only when it comes to the thing that we lost. And when it's depression, thoughts about death are linked to those feelings of worthlessness, being unable to bear the pain, and feeling undeserving of life. So these major depressive episodes and these hypomanic episodes are not something that's better explained by schizoaffective disorder, schizophrenia, schizophreniform disorder, delusional disorder, or other specified and unspecified schizophrenia spectrum, and other psychotic disorders. And the symptoms of depression or the unpredictability of switching between these hypomanic and major depressive episodes interferes with your everyday functioning. There's a number of specifiers to clarify what's going on when we're talking about bipolar 2. Let's get into what those are here. So you have mild, moderate, and severe, just to describe like the number of symptoms that are occurring in these two different kinds of episodes when you have bipolar 2. You have impartial remission, which is when there's a period of less than 2 months where no symptoms are present, or there's a period where the full criteria for the disorder is not met. You have in full remission when in the past 2 months there have been no symptoms present. There's with anxious distress, and with anxious distress you have to have at least two of the following. So tense feelings, restless feelings, trouble concentrating because of worry, fear that something awful is going to happen, or feeling like you might lose control of yourself. So any two of those, and when you have with anxious distress, it indicates longer duration of symptoms, higher suicide risk, and greater likelihood of treatment non-response. So it's important to note. You also have with mixed features. So with mixed features, it's going to depend on whether we're talking about a hypomanic episode or a major depressive episode. So if you're having a hypomanic episode with mixed features, you have to have at least three of the following. So depressed mood or dysphoria, that's something that can be reported by other people. Diminished pleasure in or interest in most or all activities, again, can be reported by other people. Slowed physical movement, that is something that must be seen by other people. Loss of fatigue or energy. Loss of energy or feelings of fatigue. Inappropriate guilt or feelings of worthlessness. And recurrent thoughts of death, suicidal ideation without a plan, or suicide attempt, or a specific plan for committing suicide. So any three of those. And if you have mixed features with a major depressive episode, you have to have any three of the following. So expansive elevated mood, grandiosity or inflated self-esteem, pressure to keep talking or more talkative than usual, racing thoughts and flights of ideas, increase in goal-directed activity and energy, increased involvement in activities that have a high potential for painful consequences like overspending, sexual promiscuity, poor investments, and decreased need for sleep, feeling rested despite having a less amount of sleep than you normally would. So mixed features can be either one of those, hypomanic or major depressive episode, and these things are something that has to be observable by others and has to represent a change from your usual behavior. If these symptoms are met for major depressive episode and hypomanic episode together, then you would call it with mixed features in relation to manic, the hypomanic episode. You wouldn't use the major depressive episode. And all of this altogether is not due to something that's going on with the substance that you're using. So that's with mixed features. We also have with melancholic features, and with melancholic features you have to have one of the following during the most severe period of the depressive episode. So loss of pleasure in almost all or all activities, or no reaction to things that are usually pleasurable. And in addition to that, you have to have at least 3 of the following. So profound despair, moroseness, or despondency caused by depressed mood. Depression is worse in the morning. Excessive activity or slowed activity. Significant weight loss or anorexia. And inappropriate or excessive guilt. So any 3 of those. And it's when you have with melancholic features, that's more likely to occur in a mild depression and in a depression with psychotic features. There's also the specifier of with rapid cycling. And with rapid cycling, you have at least 4 hypomanic or major depressive episodes within the previous 12 months. The episodes must be separated by partial or full remission, or there must be a switch between the two. The episodes cannot be caused by a substance or a medical condition. And with people who have bipolar 2 disorder, if 5 to 15% of those people are going to have the with rapid cycling specifier. We also have with atypical features, something that occurs during major depressive episodes, and it doesn't mean that it's uncommon or unusual. The atypical name is just something that came down from the way that they were described it over time. So what it means is that there's mood reactivity, which means your mood brightens, and you have to have 2 or more of the following for it to be with atypical features. So significant increase in appetite or weight, hypersomnia, leaden paralysis, which is when your legs feel very heavy, long pattern of rejection sensitivity that limits your functioning, which is a trait, and so 2 of those or more. And when you have with atypical features, it cannot be in addition to with melancholic features or with catatonia. You could also have with psychotic features, which is when there are delusions or hallucinations present. So with mood congruent psychotic features are when the content of delusions and or hallucinations are consistent with depressive themes like nihilism, disease, death, personal inadequacy, guilt, and deserved punishment. With mood incongruent psychotic features would be when the content of the delusions and or hallucinations do not involve those themes, or there's a mixture of both those themes and mood incongruent themes. There's also the specifier of with catatonia, which features catatonia. I do have a video on catatonia if you want a description of that. There's the specifier of with peripartum onset, which is when symptoms occur during pregnancy or the 4 weeks following delivery. There's 3 to 6% of pregnant women are going to experience that. 50% of instances begin prior to the delivery of the baby, and they can feature psychotic episodes, which may lead to infanticide. So it's important to note when it's with peripartum onset. There's also with seasonal pattern. And when you were talking about with seasonal pattern, there's a major time relationship between the onset of episodes. For example, fall or winter, and they do not include when there are regular seasonal stressors in your life. For example, when you have a seasonal job, maybe you get laid off in the summer, so your mood goes down. That would not be something that's related to bipolar 2 with seasonal pattern. There's also a full remission that occurs during a characteristic time of the year. For example, it clears up in the spring. It's something that's happened in the last 2 years with no non-seasonal depressive episodes occurring. There's seasonal episodes greatly outnumber the non-seasonal episodes during the person's lifetime, and in higher latitudes and younger age, you have a higher risk for recurring winter episodes. So all those specifiers, now we've got those covered. What is treatment? Treatment, you have cognitive behavioral therapy, psychodynamic therapy, family therapy, medication. Medication's big when it comes to bipolar, but of course you want to see somebody who can put together a plan that's appropriate for you, a professional who knows what they're talking about. So we have special care when you're assessing children when we're talking about bipolar disorder, because children have developmental stages that can sometimes appear like bipolar. So just be very careful, and again, see a professional who'll be able to assess everything properly when we're talking about children. Bipolar, 2 is not a lesser form in any way of bipolar 1. It is, what it means typically is that the depressive episodes actually last longer and illness may last longer. So don't think because it's the number 2 in any way, it's less than number 1. 5 to 15% of people with bipolar 2 are going to have a manic episode, which then changes the diagnosis to bipolar 1. 60% of people with bipolar 2 have 3 or more co-occurring disorders, with 75% of people having an anxiety disorder, 37% having a substance use disorder, and 14% having an eating disorder, with binge eating being the most common. And then 1/3 of people with bipolar 2 will also attempt suicide. So there are hotlines, there are text lines, there are chat lines. If you're feeling suicidal in any way, please get on one of those helplines as soon as you can and get the appropriate help that you need. All of that said, what does it feel like having bipolar 2 disorder? So it's going to feel the same as bipolar 1 with some minor distinctions, but in the body, during a depressive episode, you're going to feel insomnia, hypersomnia, fatigue, change in weight or appetite, anxiety symptoms, aches and pains. And during a manic episode, you're going to have increased energy. You may be fidgety, need less sleep. You may feel increased sex drive. When it comes to your thoughts and your brain, what's going on during a depressive episode, you may have trouble thinking or concentrating, trouble making decisions, difficulty recalling things, thoughts of death, suicidal ideation, inappropriate self-blame. During a manic episode, you may have racing thoughts and ideas, those flights of ideas, easily distracted, and you may deny that you need treatment. You may get upset when people try to tell you that you need treatment. Emotionally, during a depressive episode, you may feel intense sadness, anhedonia, alexithymia, melancholy, irritability if it's a child, or anger, guilt, low self-esteem and self-worth, hopelessness. When you have a manic episode, you may have high self-esteem, grandiosity, including grandiose delusions. You may feel cheerful, you may feel high or on top of the world. You may also have some irritability, and you may become hostile when somebody points out that you're manic or when you're challenged in any way. When it comes to your behavior during a depressive episode, you may find that you have outbursts, you may withdraw socially, neglect pleasurable activities, you may have less interest in and desire in things like sex, trouble sitting still, you may find yourself picking at things, slowed speech and reactions, poor performance in school or at work, and you may prepare for or attempt suicide. And when it comes to a manic episode, behaviorally, specifically for bipolar 2, you may find that you're more impulsive. You may feel that you have that need to talk, start conversations with strangers. You may speak loudly, dramatically, switch topics quickly, and you may refuse to be interrupted while you're talking. You may have a lot of activity aimed at starting new projects and achieving goals. You may have more engagement in activities that will result in pain, including spending sprees, sexual promiscuity, making bad investment choices, things like that. So this has been a mouthful to talk about bipolar 2 disorder, but I hope it's given you a nice, well-rounded human perspective on what it's like to have bipolar 2 disorder. If you have it yourself or you know someone that you love has had it, I'd love to hear your experience, so please leave that in the comments below, and I thank you for taking the time to learn about bipolar 2 disorder with me today. Thank you. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.